Thank you for including me in the 2021 Age Boom Academy. I'm a big fan of the Academy. I think it's a wonderful idea to bring together thought leaders in journalism to understand important issues related to aging and then bring about social change as a result. And the topic of combating loneliness in aging is such a timely issue. I'm going to focus on ageism as a cause of loneliness and propose a solution based on this cause. So just to start off with, ageism is alive and well. We have many examples of this. First of all, before the pandemic began, there was a survey conducted in University of Michigan that found that 65% of older persons commonly experience ageism. And then, unfortunately, during the pandemic, we know that ageism has been thriving. So, politicians have been suggesting that older persons are burdensome and have less value than other members of the population. We also know that there are examples of structural ageism during the pandemic. So, for example, at the beginning of the pandemic, we know that about 40% of the deaths were taking place in nursing homes, and many analyses have suggested that this is due to ageism in part because they were understaffed, underfunded, and not provided with adequate personal protective equipment. In a recent analysis, I worked with a healthcare economist to try to understand the cost of ageism in the United States. And we found that in 1 year, the total cost was about $63 billion of the cost of ageism on older persons' healthcare. And that was greater than what we spend on morbid obesity. So it's really a prevalent and important issue. So what I'd like to do today is cover three areas. The first is the idea that ageism leads to loneliness on an individual level. The second is that ageism leads to loneliness on a structural level. And the third is that a solution to fighting loneliness is to target ageism on both of these levels. So just to get started with the first idea that ageism leads to loneliness on an individual level, a framework that I have found very helpful in thinking about how it's possible that these messages that exist in our culture can directly impact older persons, including their loneliness, is to think about how this theory that age stereotypes are embodied when they're internalized from the culture, which lead to self-definitions or how people think about their own aging as they get older, and this can influence functioning and health in later life. And according to this theory, there are 4 ways that these age stereotypes, and just to be clear, I'm defining an age stereotype as a belief about an older person. And so we have, according to this framework, age stereotypes are internalized by children as young as age 4, and then they're reinforced across a lifespan. They can operate unconsciously or without awareness. They gain salience from self-relevance. So when we get older and these age stereotypes are actually describing our own group, they become particularly impactful. And lastly, they use multiple pathways to impact different kinds of outcomes, including loneliness. And so, for example, one of the pathways is through stress. So we know that negative age stereotypes can increase stress levels, and then we know stress levels in turn can lead to different kinds of poor health outcomes. So what has the research shown that connects negative age stereotypes to loneliness? Well, we know there was a study that was done that found that negative age stereotypes on an experimental level directly led to increases in loneliness reported by older persons. And in our research, we've conducted a number of studies that have found that negative age stereotypes can cause poor health outcomes. And each of those health outcomes, in turn, we know can lead to social isolation and loneliness in older persons. So, for example, we have found that using different kinds of methodologies, including experiments, cross-cultural studies, and studies where we follow people over time in the community, we have found that negative age stereotypes can lead to worse mental health, such as depression, lead to worse hearing, can lead to worse cognitive health, such as dementia, and also can lead to worse physical health, such as physical disability. And so each of those outcomes we know can lead to greater loneliness. And just to give you one example of one of the projects that came from our study, our research group, we found that negative age beliefs are associated with developing dementia. So this is a study that started off with people that were older persons who were free of any kind of dementia symptoms, and then they were followed over the next 6 years. And what we found is, if you look at those in the green bar are those who had the more positive age beliefs, and those in the orange bar are those who had the more negative age beliefs. And what you can see is that those who had more negative age beliefs were about twice as likely to develop dementia. And we also found the same pattern in the two bars on the left, which even among those who have the ApoE4 gene, which is the risky gene for developing dementia, even among those that group, those who had more negative age beliefs were about twice as likely to develop dementia. Or if you flip that around, the positive message is that those who are able to take in more positive age beliefs have about half as likely a risk of developing dementia. So the second big idea that I'd like to talk about is that ageism can lead to loneliness on a structural level. And I'm going to cover 3 areas of structural ageism. So the first is social media, I think, is an important area. So we conducted a study and found, looking at all publicly accessible Facebook groups that concentrate on those 60 and older, that the majority of the groups expressed a negative age stereotype. 37% advocated banning older persons from activities, including driving and shopping. And what's particularly disturbing about this is that, there's messages such as CEO Zuckerberg, who says Facebook can lead to better understanding of the lives and perspectives of others. And yet we see the opposite occurring on social media when it comes to ageism. There's also evidence, a second area of structural ageism that may impact loneliness is through age segregation. And we know that age segregation is prevalent in housing, in the built environment, and also in employment. And in a recent important paper that Dean Freed wrote, she said, US today is the most age segregated society in the history of the world. And there's a lot of evidence of that. And so, for example, in the workplace, there was a study conducted by the AARP that found that 2/3 of workers in the US said they've witnessed or personally experienced age discrimination. And this includes forced retirement, which we know can increase loneliness in the older population for people who want to continue to work. The third area of structural ageism that I wanted to mention is a study that was just accepted for publication. So it hasn't come out yet, but should come out any moment now. And in that study, we looked at the role of media in carrying out messages that may convey negative age stereotypes and which may in turn impact loneliness. And so we found in this study that these kinds of messages really matter. We exposed older persons to messages based on actual news stories that appeared during the pandemic. And what we found when we randomly assigned the participants to either these positive or negative age stereotype news stories is they had a direct impact on their anxiety level and their peacefulness level. So those who were exposed to the negative age stereotype messages were significantly more likely to show an increase in anxiety and a decrease in peacefulness. And just to give you one example of the ways that we tried to match the conditions with the same information, but just presented with different messages. And so, for example, coming from actual news stories, one would emphasize that 13.4% of older persons die from COVID, whereas another one emphasized that 86.6% of older patients survive from COVID. So it's the exact same information that is being portrayed, but with different types of messaging that it can have real impact on older participants or older individuals in the community. So the last idea that I'd like to cover is that ageism, the solutions to fighting ageism can draw on this understanding of loneliness as being in part rooted in ageism. So I think it's important to think about targeting ageism on both an individual and structural level to combat ageism. And I'd like to just briefly talk about these 2 levels. So we know on an individual level, we've conducted research in the field and have found that presenting positive images of aging can bring about changes in how people think about aging in general, and also their own aging, and also their physical function can actually improve when they're presented with positive age stereotypes. And this effect actually can grow in time, which is what we found in this study. On a structural level, we also can target ageism. And something that's occurring right now is the World Health Organization has started a global campaign to combat ageism. The goal, it now has 194 countries that have endorsed it. And we're delighted that our research has become part of the evidence base in both the campaign and a global report on ageism, which was just released. Lastly, I was trying to think about different ways that we could fight ageism on a structural level to reduce loneliness in addition. And some of the things that came to mind are the UN Convention on Strengthening the Human Rights of Older Persons. So this is something that is making its way through the UN. Unfortunately, the United States has not yet supported it, but hopefully they will in the near future. We also know that intergenerational contacts, which is an important way to reduce structural ageism. And we know, for example, the Experience Corps that Dean Fried has been the founder of is really effective in this way, realm. Also, I think we need better regulation of the anti-aging industry, which profits from ageism. And lastly, we need to improve messaging about older persons, both in social media and traditional media. So thank you so much for listening to my thoughts on this topic, and I look forward to joining you in the Age Boom Academy. And lastly, I'd just like to acknowledge the funders and some of the collaborators on this research. Thank you.